Our lungs are remarkable organs that work silently to deliver oxygen with every breath. Unfortunately, lung disease often begins quietly and is mistaken for minor issues such as allergies, aging, or stress. For many women, the first signs are subtle: an irritating cough, unusual fatigue, or shortness of breath while climbing stairs. While these symptoms may not seem alarming at first, research shows that women, even those who have never smoked, are increasingly vulnerable to lung diseases such as asthma, chronic obstructive pulmonary disease, COPD, infections, and even lung cancer. Recognizing these early warning signs can make the difference between early treatment and late, life-threatening complications. Why women should pay attention. Traditionally, lung disease was thought to be more common among men, especially smokers. However, studies have proven that women face equal, and sometimes greater, risks. Women generally have smaller lungs and narrower airways, making them more sensitive to smoke, pollutants, and chemical exposure. Indoor cooking fumes and secondhand smoke are also significant risk factors. Moreover, hormonal differences and genetic susceptibility can increase the likelihood of disease. Adenocarcinoma, a form of lung cancer more common in women and non-smokers, grows in the outer regions of the lung. Because of its location, it often develops silently without early, obvious symptoms. This makes it even more important for women to take persistent coughs, chest discomfort, or unexplained weight loss seriously. How the lungs whisper before they shout. Lung disease rarely starts with dramatic symptoms. Instead, the lungs whisper through subtle changes before the signs become severe. A mild cough, a slightly hoarse voice, or a bit of extra tiredness may not raise alarms, but these are the body's first alerts that something is wrong. Doctors emphasize a simple rule: if a symptom is new, persistent, and unexplained, it should not be ignored. For example, a cough that continues for more than 8 weeks, or breathlessness that interferes with daily life, is a strong signal to seek medical evaluation. Key early warning signs of lung disease. Persistent cough. A cough that lingers for more than 8 weeks should always be taken seriously. Unlike a short-term cough caused by a cold or flu, a persistent cough does not go away and may even worsen over time. It can be dry and irritating, or it may bring up phlegm on a daily basis. In many women, this is often brushed off as seasonal allergies or throat irritation, but in reality it can be linked to deeper problems such as asthma, chronic obstructive pulmonary disease, COPD, gastroesophageal reflux disease, GERD, or even lung cancer. Scientifically, this happens because inflamed or irritated airways trigger the cough reflex repeatedly, and in cases of lung cancer, tumors may directly irritate or block the passages. If a cough continues for weeks despite home remedies or standard treatment, it is a clear signal that the lungs are under stress and require medical evaluation. Shortness of breath. Shortness of breath, medically known as dyspnea, is often mistaken for a lack of fitness or simple tiredness, but when it appears suddenly or worsens over time, it may point toward underlying lung disease. Women may notice that climbing stairs, carrying groceries, or even walking a short distance feels unusually difficult, with a sensation that the lungs cannot keep up with the body's demand for oxygen. This problem occurs when the lungs' ability to exchange oxygen and carbon dioxide is compromised, as in asthma, COPD, or interstitial lung disease. Sometimes heart conditions can also contribute, but in all cases the symptom reflects reduced efficiency of oxygen delivery. If breathlessness is new, getting worse, or present even at rest, it is a warning sign that should never be ignored. Wheezing or chest tightness. Wheezing is a distinctive whistling or squeaky sound that occurs during breathing, often most noticeable when exhaling. Many women describe it alongside a sensation of tightness or heaviness in the chest, as though something is pressing down or squeezing from within. This symptom develops when the airways become narrowed, blocked, or inflamed, making it harder for air to move freely. The narrowing may be caused by asthma, COPD, infections, or allergies. While occasional wheezing linked to seasonal changes or dust exposure may not be alarming, frequent episodes or worsening tightness should prompt medical attention. Persistent wheezing can mean that the lungs are struggling against chronic inflammation, which left untreated may lead to permanent damage. Changes in mucus or phlegm. The lungs naturally produce small amounts of mucus as part of their defense system, trapping dust, bacteria, and other harmful particles. However, when the quantity, color, or consistency of mucus changes significantly, it signals a potential problem. Thick or excessive mucus that is yellow, green, or rust-colored often indicates infection or chronic inflammation. In conditions like chronic bronchitis, the airways overproduce mucus, making it harder to breathe and clear the lungs. More alarming is the presence of blood-streaked mucus, which can be an early sign of lung cancer or severe infection. Women should pay close attention to these changes, especially if they occur daily or worsen over time, as they reveal the inner health of the respiratory system. Coughing up blood, hemoptysis. Coughing up blood, even in small amounts, is one of the most serious warning signs of lung disease. While it can sometimes result from a severe infection that irritates the airways, it may also signal more dangerous conditions such as tuberculosis, bronchiectasis, or cancer. The presence of blood indicates that blood vessels in the lungs have been damaged, either by inflammation or by growths that erode the surrounding tissue. For many women, the first instinct may be to dismiss it as a minor throat injury, but hemoptysis is never normal. Any appearance of blood in the sputum, whether light streaks or larger amounts, requires immediate medical evaluation to rule out life-threatening disease. Hoarseness or voice changes. A change in voice quality, such as persistent hoarseness, a raspy tone, or weakness in the voice, without a recent cold or throat infection should not be overlooked. While temporary hoarseness may result from overuse of the vocal cords, ongoing changes often point to problems within the chest. Continuous coughing, acid reflux, or airway irritation can strain the vocal cords, but in some cases lung tumors pressing against the nerves that control the voice box may also cause changes. Women may notice that their voice sounds unusually rough, deeper, or weaker for weeks at a time. If hoarseness persists beyond 2 to 3 weeks, particularly when paired with cough, breathlessness, or weight loss, it should be considered an important sign of possible lung disease. Recurrent chest infections. If you find yourself battling chest infections such as bronchitis or pneumonia more than once or twice a year, it may be a sign that your lungs are struggling. Normally, a healthy set of lungs can clear bacteria and viruses effectively, but when they are weakened by conditions like COPD, asthma, or structural lung changes, infections tend to return frequently. Each new infection not only causes discomfort but also leaves the lungs more vulnerable to scarring and long-term damage. For women, repeated infections are often brushed off as seasonal colds or weak immunity, but they can be a sign of deeper issues in lung health. If chest infections keep recurring or take a long time to heal, this is a clear signal that the lungs need medical evaluation and possibly long-term management. Unexplained weight loss and loss of appetite. Losing weight without trying might seem like a positive outcome at first, but in reality, it is often a sign of an underlying health issue, including lung disease. When the lungs are diseased, the body has to work harder to maintain oxygen supply, which increases energy demands. Inflammatory processes also change the way the body processes and stores nutrients, suppressing appetite and leading to unintended weight loss. In lung cancer, tumor growth can alter metabolism and cause rapid weight loss in a short period. Women should pay special attention if clothes suddenly feel loose, meals become unappealing, or if more than 5% of body weight is lost over 6 months without dieting or exercise. Unexplained weight loss paired with fatigue or cough is a strong warning sign that should not be dismissed. Constant fatigue. Fatigue that persists despite adequate rest and sleep is another common but often overlooked warning sign of lung disease. Oxygen is the fuel that powers every cell of the body, and when the lungs cannot provide enough, the entire system slows down. Women with early lung problems may feel as though they are running on low battery all the time, even with minimal exertion. This constant exhaustion can affect work, relationships, and quality of life. Unlike normal tiredness, which improves with rest, disease-related fatigue lingers and is often accompanied by other symptoms such as cough, breathlessness, or chest discomfort. If you feel drained of energy for weeks without an obvious cause, it is important to consider that your lungs may not be functioning at their best. Chest pain or pressure. Chest pain associated with lung disease is often sharp, stabbing, or worsens with deep breathing and coughing. It can also feel like a dull pressure, as though something is pressing from the inside. This type of pain is typically linked to inflammation of the lung lining, pleura, infections like pneumonia, or in serious cases, conditions such as pulmonary embolism or tumors. For women, chest pain is sometimes mistaken for muscle strain or even heart problems, but lung-related chest pain has its own distinct pattern. If pain increases with breathing, coughing, or physical activity, it should not be ignored. Persistent or worsening chest discomfort is a strong indication that medical evaluation is needed. Shoulder or back pain. Lung-related pain is not always felt in the chest. In some cases, discomfort radiates to the shoulder or back, creating the impression of a pulled muscle or poor posture. This happens because of the way nerves transmit pain signals from the lungs and surrounding structures. Certain lung cancers, especially those located near the upper part of the lungs, can cause shoulder or back pain long before other obvious symptoms appear. Women experiencing unexplained aches in these areas that do not improve with rest, stretching, or simple remedies should consider the possibility that the cause may not be musculoskeletal but respiratory in origin. Swelling in face, neck, or skin discoloration. One of the more advanced but critical warning signs of lung disease is swelling around the face, neck, or upper chest, often accompanied by changes in skin color. Bluish lips and fingertips, known as cyanosis, occur when the blood is not carrying enough oxygen. Swelling may result from blocked blood flow in large veins of the chest, sometimes due to a mass pressing on them. For women, this can appear suddenly as puffiness around the eyes, fullness in the neck, or discoloration of the skin. These symptoms indicate that lung function is severely compromised and require immediate medical attention. Why these symptoms are critical for women. Lung disease does not always present the same way in women as it does in men. Research has shown that women often experience symptoms that are more subtle and less dramatic, which makes them easier to dismiss as minor or temporary issues. For example, a persistent cough or a little shortness of breath may be blamed on allergies, aging, or lack of fitness. However, these seemingly small changes may actually signal the early stages of a serious condition. Lung cancer among women who have never smoked is an increasing concern, and its symptoms are often vague in the beginning. Risk factors such as prolonged exposure to air pollution, secondhand smoke at home or work, and hormonal influences can further increase vulnerability. Because of these differences, women must pay special attention to even the mildest but persistent changes in their breathing, energy levels, or general health. Early detection leads to more effective treatment, and ignoring the early signs can delay diagnosis until the disease has progressed to a more advanced stage. When to seek medical care. Knowing when to seek medical help can be life-saving. A cough that continues for more than 8 weeks should not be ignored, as this is considered chronic and often points toward a deeper respiratory issue. If shortness of breath begins to interfere with simple daily tasks such as walking or climbing stairs, it is another clear indicator that medical evaluation is necessary. Coughing up blood, no matter how small the amount, is never normal and always requires urgent attention. Persistent pain in the chest or shoulder that does not improve with rest may also be related to the lungs rather than muscle strain. Similarly, if a woman notices unexplained weight loss or constant fatigue despite normal sleep and diet, her lungs may not be functioning properly. Frequent chest infections that take longer than usual to heal also suggest that the lungs are under stress and losing their natural defenses. When these warning signs appear, doctors may recommend diagnostic tests such as chest X-rays, breathing function tests like spirometry, or even low-dose CT scans to rule out or confirm serious disease. Screening for lung cancer. Screening is a critical tool in detecting lung cancer at an early stage, when it is most treatable. The U.S. Preventive Services Task Force, USPSTF, currently recommends that adults between the ages of 50 and 80 who have a smoking history of at least 20 pack years undergo annual low-dose CT scans. This includes people who currently smoke or those who quit within the past 15 years. The American Cancer Society, ACS, supports these guidelines but goes one step further, also recommending screening for individuals who quit smoking more than 15 years ago. Despite these recommendations, no routine screening exists for women who have never smoked, even though they are also at risk of developing lung cancer. This makes it even more important for women to remain vigilant about early warning signs and to discuss personal risk factors with their healthcare providers. Awareness and proactive monitoring are key defenses when formal screening programs are not available for certain groups. Protecting lung health. While not every risk factor can be avoided, there are many proactive steps women can take to protect their lung health. Avoiding both smoking and exposure to secondhand smoke is the most important preventive measure, as smoke is one of the leading contributors to lung disease. In homes where cooking smoke is common, ensuring proper ventilation through exhaust fans or open windows can reduce harmful inhalation. Staying up to date with vaccines such as influenza, COVID-19, and pneumococcal vaccines is also crucial, since these infections can severely impact already vulnerable lungs. Regular physical activity helps improve lung capacity and strengthens respiratory muscles, while deep breathing exercises can further enhance lung function. Keeping a daily or weekly symptom diary is another useful tool. By recording when symptoms occur, how long they last, and what triggers them, women can provide doctors with valuable information that supports faster and more accurate diagnoses. Small lifestyle choices and habits can make a big difference in maintaining strong, healthy lungs. Women's lungs are resilient but at the same time vulnerable to both biological differences and environmental exposures. The early signs of lung disease, such as a persistent cough, unexplained breathlessness, hoarseness of voice, recurring chest pain, frequent infections, chronic fatigue, and sudden weight loss, should never be dismissed as trivial. These are the lungs' whispers, subtle signals that something is not right. Listening to these whispers and responding promptly by seeking medical advice can save lung function, overall health, and life itself. It is important to remember that lungs rarely give dramatic warnings in the beginning. They whisper first, and only later do they shout. Paying attention to these whispers at the earliest stage gives women the best chance at timely diagnosis, effective treatment, and a healthier future. This video is for educational purposes only and should not replace medical advice. If you experience any of these symptoms, consult a qualified healthcare professional.